Hello viewers, I am dermatologist Dr. Wakar. Today we will discuss that what you can expect when you come for a consultation to me. So during a consultation for the facial augmentation, I first of all take a history of the patient and of my clients, that is there any complications they have before, or they have done any facial procedures before coming to me. So this is necessary to know the history of the patient always in the facial augmentation process. That for example, that if someone has taken the fillers before, so it should be in the knowledge of the doctor. So then you will fill the performa in which it is written that is there any physical morbidity that you have, or is there any allergic reactions you have in the past. So after that, what's the point is that why facial augmentation is necessary, and why the people are getting these things in the younger age like that. So actually what I realized in my practice is that the facial augmentation or the facial beautification processes that the dermatologists and plastic surgeons do is because it gives you a face that you want, a face that you like, and a face that you can show up to the people, and that is as per your own facial features. Like for example, if someone has nasolabial folds, or if someone has the wrinkles around the forehead, it looks awkward these days. Like if you have not done proper attire, similarly if you have not done the proper Botox and fillers, you feel awkward, and it should be like that, because it gives too much happiness, it gives too much pleasure and ecstasy to the people that when they do the Botox and fillers. Like if we see our today's patient is a beautiful lady, and who has come to us for a facial augmentation process that she wants to follow. So first of all, when we see her face, we see from the front that what are the dimensions of the face, from the right angles, from the left angle, and we start from here, that is there any static wrinkles. Then we see about the orbital area, that is there any like eye mark here, that she needs augmentation here. This is the tear trough that she has, and because she is now wearing some makeup, so it is not visible, but these would be very visible without makeup, that these dark circles, that is because of the tear trough. And then we see about the lateral area, that is there any temporal depression. Then we see about the cheeks, that if we see the cheeks needs to be lifted, that we want to put some volume here, because she has the lower face is more heavy in volume. So regarding the lower face, we see that she has some nasolabial folds here, some marionette lines here, and there is some facial commissures. This facial commissures also needs a little volume support from down. And then we need that because of she has some double chin, so for this double chin we will do a minor liposuction and then the lifting by the threads. So for this lady, after consultation, I will tell her that because of her lower face has more volume, we also want a little bit raise up here. So when we raise up here and we put some volume here, and then we raise a little bit, increase the length of the chin, it will give the beautiful face to our patient. Before doing the procedures, we do the simulation effect, because every face has different facial features, and we just want to see that how it will look. So for the simulation, we also need to keep in our mind about the pinch anatomy, that if we do like this, how the face appears, and then we do like this, that how the face appears. So by this both phase, we need to assess that which type and which will be the vectors for the thread lifting. Similarly, for this we need to do the simulation, that if we do the facial features like this, then how it will appear. So the simulation is the most important for every patient, that before doing the procedure we should go for it.
Oh wow. Doctor, you're so amazing.
Thank you, thank you. If you see that we have done the under eye fillers, and then we have done this cheek elevation, the bone of the cheek, and we have done some lower face. So if you see the whole of the face that we have tried to make it. So the next thing that we need to do on the next step is that we will do some liposuction here, and we will do some two threads here for lifting this and to remove the double chin. So like this, for our patients, we do the facial augmentation, and by this facial augmentation, their face becomes more like what they want, and that is what's the definition of the beauty is.